Welcome to the Neuroscience Education Institute podcast. I'm Dr. Sabrina Siegel, and I have here today with me Dr. William Sauvé. And the topic of our conversation today is transcranial magnetic stimulation, or TMS. For those people who don't know what TMS is, could you say just a brief summary and kind of introduce what this technique is?
Absolutely, and thanks for having me. Transcranial magnetic stimulation is, in the most general terms, a non-invasive way to electrically stimulate the brain. And that makes it probably one of the first new things in several decades to come to mental health treatment. Unlike electroconvulsive therapy, because many people kind of fearfully compare it to that, this electrical stimulation is not something that you would ever feel. So this is an office-based procedure. We take advantage of a powerful electromagnetic field to induce electrical current inside the brain. There is no change in a person's level of consciousness while they're undergoing the treatment. They will feel nothing except for largely an annoying tapping sensation against the head. I've met very few people over the years who had any difficulty tolerating it, and there's no mandatory recovery time afterwards. And frankly, in most of our offices, we have TVs bolted to the wall so people don't get too bored during the treatment. We give them a remote, we let them change the channels, and treatments now typically take about 20-ish minutes or so. The minute a treatment's done, people get right up typically and walk right out. It's okay to drive their car. I treat plenty of people who go to work or school right after a treatment, and it's fine. It typically doesn't interfere with any other part of their day. And most importantly, we're finding it to be a very successful treatment for depression, particularly in people for whom medications haven't worked. And that is in fact the FDA indication since 2008 for someone to have not benefited from at least one antidepressant medication trial.
That sounds so exciting.
Doesn't it?
And it does, absolutely. And so we know that TMS is approved for the treatment of depression, but can you speak to some of the success stories that you've had with treating other kinds of conditions? Anything else other than depression?
I mean,
You
sure.
talk about depression too, but
Because who doesn't want to talk about depression? But the really exciting thing about TMS, the magnetic field that is generated with most commercially available TMS devices now can probably reach between 2 and 3 centimeters below the skull. So when you're thinking about treating the brain, think of the fact that you can stimulate almost anywhere on the human brain within about 2 to 3 centimeters below the skull. And then more importantly, the brain we're kind of getting better and better at knowing now, is really a bundle of circuits. So when you stimulate superficial areas, you can actually change the function of deeper cortical areas that are interconnected, and you're really changing the function of networks. So when it comes to what's possible with TMS, just about anything, use your imagination. And a search for transcranial magnetic stimulation on PubMed or whatever you want will now generate thousands and thousands of articles, and everybody is looking for a way to treat everything from smoking cessation that is being worked on, and auditory hallucinations and schizophrenia, like we were talking about a little bit earlier. I personally, just one of my favorite stories, did successfully treat a young boy with Tourette's disorder. His father actually came to me with the treatment protocol on a piece of paper that he had gotten from the gentleman who was doing most of the publications at Columbia, because he actually knew him personally. So he brought me a custom-made protocol and wanted to know if I would do that for his son, and I said, of course, because that sounded like the best day ever. And we stimulated his supplementary motor area. This little boy was 9. We had to put multiple phone books and other debris around the office, under his little body to get his head up to the coil. But once we started this protocol, he went from having hour-long abdominal ticking episodes that would leave him exhausted, that he'd have to take a nap sometimes after these episodes. And by the end of about 10 sessions, His mother reported to us that he was going entire days without having any tics at all, and his parents were over the moon. The best part about that case is that he did end up being one of those lucky kids that seems to spontaneously remit. So we treated him ultimately intermittently on a maintenance pattern for about 2 years. And then one day his mother called us and said, I don't think we need to come back because he's fine. His tics were not re-escalating, and so he seemed to be doing well, and he never had to take psychotropic medication.
That is such a great story. I love it. Okay, well, thank you so much. I think that does it. And thank you for tuning in to the Neuroscience Education Institute podcast.